There is a transition nobody prepares you for. A quiet internal reorganization that begins somewhere around the age of 80, and it makes no difference how formidable you were in your 60 seconds. It makes no difference how vital you were throughout your 70 seconds. It does not matter how many miles you logged, how many mornings you spent at the gym, or how physically capable you once were. The moment you cross into your 80 seconds, your body begins operating under an entirely different set of biological rules. And if you do not understand what those rules are, they will catch you completely unprepared, in ways that can genuinely and permanently alter the trajectory of your remaining years. Here is what frustrates me most as a physician. The vast majority of people do not encounter this information until they are already living with the consequences. They come into my office confused, shaken, sometimes frightened, and they say, "Dr. Michonne, I was completely fine just a year ago. What changed?" And I have to sit across from them and explain that their body did precisely what it was always going to do. They simply were never given the map ahead of time. So today I am going to make sure that does not happen to you, or to someone you care about. Whether you are already in your 80 seconds, approaching that decade, or you have a parent or grandparent in that range, what I am about to share could rank among the most consequential health information you ever encounter. My name is Dr. Michonne, and on this channel we cover real, substantive health information that genuinely matters, particularly for those of you navigating your senior years. If you have not already, go ahead and subscribe and turn on notifications, because I release this kind of content consistently and I do not want you to miss it. Now let us get into this, because what follows is something most people will never hear stated this directly. The first change that occurs once you cross into your 80 seconds, and this one blindsides almost everyone, is that your body begins shedding muscle at a rate unlike anything it has done before. I already know what some of you are thinking. You are saying, "Dr. Michonne, I have been hearing about muscle loss since my 50 seconds. This is not news to me." And you are right. Muscle loss does begin as early as your 30 seconds and continues at a measured pace throughout the following decades. But here is the piece most people never learn. The rate of muscle loss between the ages of 30 and 70 is relatively gradual and, with effort, manageable. You might lose somewhere between 3 and 5% of your muscle mass per decade during those years. But once you enter your 80 seconds, that figure accelerates sharply. We are talking about losing up to 15% of your remaining muscle mass within a single decade. And in some individuals, the decline moves even faster than that. This condition has a clinical name, sarcopenia, and after 80, it becomes one of the most serious threats to your independence, your mobility, and frankly, your survival. Here is why this matters so profoundly. Muscle is not simply about physical appearance or the ability to move heavy objects. Your muscles are what hold you upright. They are what stop you from hitting the ground when your foot catches an uneven surface. They are what allow you to rise from a chair unassisted, to navigate a staircase, to carry your own groceries, to maintain the basic functions of daily life that most people never stop to appreciate until they are gone. When your muscle mass drops below a critical threshold, and this is the part that genuinely alarms me as a clinician, your fall risk escalates exponentially. And a fall at 80 is categorically different from a fall at 50. At 80, a fall frequently means a fractured hip. And a hip fracture at that age carries a mortality rate that shocks most people when they first hear it. Research indicates that somewhere between 20 and 30% of elderly adults who sustain a hip fracture do not survive the following year. Not as a direct result of the fracture itself, but from the cascade of complications that follow. The immobility, the infections, the blood clots, the accelerated systemic decline that accompanies extended time spent bedridden. So what can you do? And this is where I want to offer you practical guidance, not just alarm. Resistance training does not stop producing results simply because you have reached 80. The research is consistent and genuinely encouraging. Even individuals in their 80 seconds and 90 seconds can build muscle and increase functional strength through appropriate exercise. I am not suggesting heavy bar lifts or aggressive gym routines. I am talking about accessible, safe, supervised strength work. Chair squats, resistance band movements, light dumbbells, body weight exercises. These can produce a real, meaningful difference. What matters most is regularity. at least 2 to 3 sessions per week, and protein intake is equally critical. The majority of seniors in their 80 seconds are not consuming enough protein, and that deficiency is actively accelerating their muscle loss. Target at least 1 gram of protein per kilogram of body weight each day, distributed across your meals rather than concentrated in one sitting. Your muscles require that steady supply of amino acids to maintain themselves and recover after movement. The second change that occurs after 80, and this one carries a great deal of emotional weight for many people, is that your brain begins processing information differently. I want to be precise about this because there is a meaningful distinction between normal age-related cognitive shifts and dementia, and the confusion between the two causes unnecessary suffering. After 80, it is entirely normal to experience what we call reduced processing speed. Recalling a name may take a moment longer. Finding the right word in conversation may require a brief pause. Working through a decision or problem may feel slightly slower than it once did. This does not indicate Alzheimer's disease. This does not mean cognitive deterioration is underway. It is your brain operating with modestly reduced efficiency, a natural biological development. However, and this is important, after 80, the genuine risk of developing dementia does rise substantially. By age 85, roughly 1 in 3 individuals will have some form of it. That is not a figure to dismiss, and it is not one we can afford to treat as inevitable without resistance. The brain, much like your muscles, requires consistent engagement and maintenance, and the research on this is genuinely hopeful. People who remain mentally active, socially connected, and physically mobile show significantly lower rates of cognitive decline compared to those who become sedentary and withdrawn. One of the most consistent patterns I observe in my patients over 80 is a gradual retreat from social life. They stop attending their place of worship. They stop meeting friends. They pull away from community activities. They spend increasing amounts of time alone in front of a screen. Social isolation is one of the most powerful accelerators of cognitive decline we know of. The brain requires stimulation. It needs conversation, novelty, challenge, and human connection. So, if you are over 80, or you love someone who is, please prioritize staying socially engaged. Join a reading group, volunteer somewhere, take a class, play cards, work on puzzles, learn something new. The specific activity matters less than the engagement itself, and the connection it keeps you tethered to. One more element of brain health after 80 that rarely receives the attention it deserves: sleep. I recognize that sleep patterns shift with age, and that many seniors struggle with fragmented or insufficient sleep. But your brain uses the sleep window to clear out toxic protein accumulations, including beta amyloid, which is directly implicated in Alzheimer's disease. When sleep is consistently poor, those proteins accumulate at a faster rate, and cognitive risk rises accordingly. Do not simply accept poor sleep as an unavoidable feature of aging. Bring it to your physician's attention. There are real, evidence-based strategies that can help, and they can make a genuine difference in protecting your brain long-term. The third change after 80 is one that tends to generate discomfort in conversation, but it is too important to avoid. Your bones become substantially more fragile. Bone density loss, like muscle loss, begins earlier in life, particularly in women following menopause. But after 80, we reach a threshold where the cumulative loss is severe enough that even minor physical impacts can result in fractures. This is osteoporosis in its most advanced presentation, and it affects both men and women, though women carry a disproportionate share of the burden. What makes this particularly dangerous is not simply that the bones are thinner. The internal architecture of the bone, the trabecular network, the porous inner scaffolding that provides structural integrity, becomes increasingly compromised. This means that a stumble, a collision with a piece of furniture, or, in severe cases, even a forceful cough or sneeze, can produce a spinal compression fracture, a wrist fracture, or a hip fracture. And once one fracture has occurred, the risk of a subsequent fracture doubles or triples. What steps can you take? Start with knowledge. If you have not had a bone density scan recently, get one. Understand where your baseline is. Ensure you are consuming adequate calcium and vitamin D. Most adults over 80 require at least 1,200 milligrams of calcium daily and 800 to 1,000 IU of vitamin D, sometimes more, depending on blood levels. The majority of seniors I see are running low on vitamin D. Your physician can confirm this with a straightforward blood test. Beyond supplementation, the most effective single intervention for bone health after 80 is weight-bearing movement. Walking, standing exercises, gentle rhythmic movement, even the repeated act of rising from and lowering into a chair. These activities apply mechanical stress to the bones in a beneficial way, prompting them to reinforce themselves by generating new bone tissue. Inactivity sends the opposite signal. When the body perceives that the bones are not being used, it reduces investment in maintaining them. Every step you take is communicating to your skeleton that it still matters. Keep moving. The fourth change after 80 is one I watch devastate patients regularly, and it is the deterioration of balance and coordination. This is related to muscle and bone loss, but it is also a distinct and independent process. After 80, multiple systems governing balance begin to decline simultaneously. The vestibular system, housed in the inner ear and responsible for your sense of spatial orientation, becomes less precise and less responsive. Proprioception, your body's internal awareness of its own position in space, also diminishes. And vision, which contributes substantially to balance, frequently worsens further in the 80 seconds due to cataracts, macular degeneration, or other age-related ocular conditions. When you combine deteriorating muscle mass, more fragile bones, a less reliable vestibular system, declining proprioception, and reduced visual acuity, the result is a dangerous convergence of fall risk factors. The statistics on falls in adults over 80 are sobering. Approximately 1 in 3 adults over 65 experiences a fall each year, and after 80, that rate climbs and the consequences grow considerably more severe. The intervention I recommend most consistently and most emphatically is balance training. It is non-negotiable for anyone in this age range. Standing on one foot while maintaining contact with a sturdy surface, heel-to-toe walking along a straight line, Tai Chi, senior adapted yoga. These practices train the neuromuscular pathways that maintain stability, and here is what I want you to hold on to. Balance can be meaningfully improved at any age. Even if you already feel unsteady, even if you have already experienced a fall, with consistent practice, real gains are achievable. I also want to address something that is frequently overlooked in this context: medication review. Many seniors over 80 are managing multiple prescriptions, and some of those medications, blood pressure drugs, sleep aids, certain antidepressants, antihistamines, some pain medications, can contribute to dizziness, lightheadedness, or sedation, all of which directly elevate fall risk. If you feel unsteady, ask your physician to conduct a thorough review of everything you are currently taking. A modest adjustment can sometimes produce a dramatic improvement in stability. And please, do not allow pride to override safety. If a cane would help you, use one. If a walker would keep you upright, use it. If grab bars in your bathroom would prevent a fall, have them installed today, not eventually, today. These are not admissions of weakness. They are intelligent, proactive decisions. I have watched patients reject assistive devices out of pride and then suffer falls that permanently ended their independence. Do not let that be your story. The fifth change after 80 may be the most consequential of all: a significant weakening of the immune system. This process is called immunosenescence, and it is one of the primary biological reasons why adults in their 80 seconds are so much more susceptible to infections, serious illness, and certain cancers. Your immune system has been working on your behalf for your entire life, identifying and eliminating bacteria, viruses, fungi, and abnormal cells for decades. But after 80, it begins to lose capacity. The body produces fewer new immune cells. The ones that remain become less precisely targeted, and inflammatory responses become dysregulated, meaning the immune system can simultaneously overreact to some threats while failing to adequately respond to others. This is why an upper respiratory infection that a younger person recovers from in a few days can send an 80-year-old to the hospital. This is why pneumonia remains one of the leading causes of death in this age group. This is why a urinary tract infection, a manageable nuisance in a younger adult, can produce confusion, delirium, and dangerous complications in an elderly patient. The immune system at 80 simply does not carry the same arsenal it once did. What can you do to support it? Several things. First, nutrition becomes even more critical at this stage. Vitamin C and D, zinc, and selenium all play important roles in sustaining immune function. A varied diet built around fruits, vegetables, lean proteins, and whole grains provides the foundational materials the immune system depends on. Unfortunately, many seniors in their 82nds experience reduced appetite or face practical barriers to meal preparation, which creates nutritional gaps that further compromise immune resilience. Second, stay current with your vaccinations. The annual influenza vaccine, pneumococcal vaccine, and shingles vaccine can be genuinely protective, even life-saving, for adults over 80. Yes, the immune response to vaccines may not be as robust at this age as it would be in a younger person, but even a partial protective response is far more valuable than none at all. Discuss with your physician which vaccines are appropriate for your specific age and health profile. Third, and this connects to everything else we have covered today, stay physically active. Even moderate, regular movement has been shown to meaningfully support immune function in older adults. It increases the circulation of immune cells, reduces chronic systemic inflammation, and strengthens overall resilience against infection. You do not need to push yourself to extremes. A daily walk, some light stretching, gentle resistance work, these are sufficient to provide your immune system with real support. And I want to raise one final point about immune health after 80 that carries significant weight. Chronic stress and social isolation directly suppress immune function. A growing body of research demonstrates that socially isolated older adults have substantially weaker immune responses than those who maintain meaningful social bonds. Loneliness is not merely an emotional condition, it is a physiological one. It elevates cortisol, increases systemic inflammation, and suppresses the activity of natural killer cells, the immune cells responsible for identifying and destroying cancerous and virus-infected cells. Staying connected is not simply good for your emotional well-being. At this stage of life, it is essential for your physical survival. Before I close, I want to say something that I believe needs to be said far more often than it is. Turning 80 is not a decline into irrelevance. It is not the beginning of an inevitable end. I have patients in their 82nds and even their 92nds who are sharp, engaged, mobile, and deeply connected to their lives and the people in them. They are not genetic anomalies. They are simply individuals who took their health seriously, who stayed active, who maintained their relationships, who ate thoughtfully, who worked with their physicians, and who made a decision not to accept deterioration as something beyond their influence. Yes, the 5 changes I have described today are real. They will occur to some degree regardless of what you do. Your muscles will lose mass, your cognitive processing will slow, your bones will become more vulnerable, your balance will require more conscious maintenance, and your immune system will carry less firepower than it once did. These are biological facts. But the pace at which they progress, the degree to which they affect your daily function, and the impact they have on the quality of your life, that is substantially within your control. Every day you are presented with that choice. You can surrender to these changes passively, or you can meet them actively, with movement, with nourishment, with social engagement, with mental challenge, with medical partnership, and with a firm refusal to stop investing in yourself. I have seen 80-year-olds who move with more confidence and purpose than many people I know in their 62nds. I have seen 90-year-olds with minds that run circles around people half their age. Age is a number. How you age is a series of daily decisions. If this has been useful to you, please share it with someone who needs to hear it. A parent, a grandparent, a neighbor, a friend who is approaching this decade and does not know what is coming. This kind of information genuinely has the power to change outcomes. Leave a comment below telling me what you would like me to address next. I read every single one, and your input directly shapes what I create. Subscribe if you have not already, and know that this channel exists for one reason: to give you the clearest, most honest, most actionable health information I can offer. I am DR.Michonne. Your body is more capable of adaptation than you have been told, but it needs your active participation to prove it. Give it what it needs, and it will carry you much further than you ever imagined.